Hi everybody, today we're going to do something different. Rather than making 30 unique videos on some of the most common questions that are asked during facelift consults, we have endeavored to cram them all into one single video. And what better way to present these questions than to introduce my new sidekick. Hi everybody, I'm Dr. Jonathan Zelken, board certified plastic surgeon here in Newport Beach, and I want to introduce Susan Lindley.
Hello everyone.
Susan is the patient care coordinator here at the Zelken Institute, and she uniquely confronts a lot of questions that people are either embarrassed, shy, or forget to ask me during the consultation. So rather than trying to compose 30 unique videos, let us try to ask the 20 or 25 most common questions. Is that sort of what you put a list together of?
These are the lists we get all the time.
And I will do my best to hammer down some very quick answers for each of them, so your attention doesn't run out by the end of this video.
All right, ready. Okay, number one question. Is a facelift procedure right for me?
For you, or is it right for, okay, so people who are interested in facelift surgery come from all different walks of life. They are either young people looking for a snatched jawline, or they're older people who are looking to maintain their youthful beauty and to preserve themselves against the aging process. So there's a rejuvenation type of facelift versus a beautification type of facelift. I try to basically tailor everybody's facelift to their own unique medical history, surgical history, goals, and desires.
All right. Why choose Dr. Zelken?
That's a very good question. Facelift is the cornerstone of my medical practice. It is my favorite procedure. I think about it all the time. I think in the past 2 months, it is pretty much the only procedure I've been doing. I'm very passionate about facelift surgery. I care a lot about it, and I uniquely will perform certain maneuvers in my facelifts that don't have a trendy name, and it's all going to be tailored to the patient's individual, again, goals and desires.
All right, great answer. Does Dr. Zelken offer the vertical restore facelift?
So again, that's another great question, Susan. I was not prepared for this one. No, I do not offer the vertical restore facelift. There's a lot of different sort of branded name facelifts that I think individual plastic surgeons will attribute to little maneuvers and things they do. I think some people even try to copyright the names of certain facelifts, like ponytail facelift, vertical restore. No, one of these days I'm going to come up with a cool, catchy name for my own facelift.
Right.
But right now, my facelift is involved with really maximizing the jawline, preventing neck bands, platysmal bands from recurring, volumizing the midface, and really cheating the aging process so it looks natural and good. I go for subtlety.
All right. Does Dr. Zelken offer the deep plane facelift?
Okay, again, I think to be that regimented and either do a deep plane facelift versus a traditional SMAS type facelift, which I have presented in another video, which we'll link here. Every single facelift of mine has some degree of deep plane dissection, and every single one has some degree of traditional dissection, and I will literally tailor everybody's facelift to their own unique anatomy. Again, there's no fancy name for this. I think the deep plane has a lot of benefits. I think it allows us to access the buccal fat pad, for example, and to release ligaments that prevent tightening of the deeper structure of the face, but it's not for everybody, and I think to be that fixated on offering one type of facelift is putting the patient second. So yes, I do the deep plane facelift. If you want a deep plane facelift, you got it. But really, I'm going to tailor it to every individual patient.
All right. What should a patient expect during a facelift consultation?
During the consultation, it's really 30 to 40 minutes of just sort of rapping with me and looking at pictures and understanding what it is that we're aiming to achieve, whether or not less invasive options are right for you, like face tight or buccal fat pad removal or even fillers and toxins. I'm going to assess your medical history, your surgical history, to make sure that you're psychologically ready for a facelift and you know what you're getting yourself into, and really giving you an opportunity to evaluate your own pictures and ask questions.
Okay. Another question people want to know is, will this face make me look stretched?
Everybody wants to know that. I don't want to look stretched. I have friends who have a facelift and they look really stretched. I think that, historically, plastic surgeons used to tighten skin alone. And you get this instant gratification when you elevate the skin and you pull it back tight, but that leads to a lot of stretching.
Right.
As the facelift operation has evolved over the past 20 or 30 years, really we rely on not only volumization of the face, but tightening of deeper structures and load sharing. When you do all those things and you optimize the health of the skin, you are much less likely to look pulled when you're done, or have these sort of like windswept lines, or people worry about their mouth getting wider. I just haven't seen that stuff in my own practice.
Excellent. Okay, the next question people want to know is, how much time should I arrange off work?
It depends what you do and depends what we do. So assuming we're doing a traditional going to sleep 4-hour, 5-hour facelift, I think depending on the type of job that you have and your comfort level with looking a little bruised, a lot of people get bruised under the eyes and right here from fat transfer, and that's kind of the limit of what they look like at 2 or 3 weeks and so on. I think if you feel comfortable going back to work and you're not doing heavy lifting or strenuous labor, I think 2 weeks is reasonable. I think with some cover up, you can go to a nice restaurant by 3 weeks. Right. If you're doing heavier lifting, you're in strenuous labor, patient transfers, things like that, it might be closer to a month before I feel comfortable sending you off to the wolves.
All right, good answer. Okay, how long does the surgery typically last?
It depends on what we do. I think, as you know, you're asking a question you know the answer to, but patients don't. 4 to 5 hours usually for a basic facelift. And that includes adjuncts like fat transfer, that includes like buccal fat pad removal if we decide to do some of that. But if you want to do more, like at the same time, can you touch up my nose? Can you touch up my eyes, brows, things like that? Can we do laser at the same time? Can we do breast surgery at the same time? Obviously, that's going to increase the length of surgery. I don't like to do much surgery beyond 6 hours, 8 hours if you really push me. But I think as long as it's under 6 or 7 hours, you're pretty safe, and and I can do quite a bit in that time frame.
Will I need someone to take me home?
Yes, you will, absolutely. I don't. After 8 hours of surgery.
These are everyone's questions.
No,
not
I know. And after 8 hours of surgery, you definitely do not want to go right home. I think you're going to be a little loopy. Yeah. So I recommend for most facelifts going to a rehab facility the first night. I think there's a nominal fee for that. But at the very least, if you don't do that, you need somebody who you love to drive you home and provide you safe driving. Okay,
another common question is, what anesthesia is used?
That's a great question. Usually, with various exceptions, I do more facelifts asleep than awake, even though I feel comfortable doing awake facelifts, and I think we have a video on that. When we do a sleep facelift, it's usually general anesthesia with a tube put in the back of your throat to help protect your airway. And it sounds really scary, but it's incredibly safe. Patients who are afraid of doing that can also opt for IV sedation, although I don't think that's as good as an option.
Okay. What's the difference between a facelift, a mid-facelift, and a neck lift?
Great question. I hear that one all the time, too.
Yeah.
So everybody, says, my friend got an upper fifth facelift, mid fifth, lower fifth, quarter fifth facelift, and then a brow lift at the same time as a neck lift. No, in my practice, as you know, facelift is everything from the temples down to the collarbone. Okay. Can we do a mid facelift in isolation? We can, but I think there's a lot of limitations to that. So a facelift is a facelift is a facelift. It includes fat transfer. It includes buccal fat remodeling if we need it. And that's how it works in this practice.
All right. Next one. Can I get a neck lift independent of a facelift?
Okay, I was about to go there too. So yes, I think some people just want a neck lift. We do technically offer a neck lift. So the answer is yes. You can get a neck lift separate from a facelift, but I really, really discourage it in most patients. Okay. If you have a really good jawline and isolated neck laxity, yes, you can consider it. If you're a male and you're looking for a direct neck lift where we cut skin off alone, yes, we can consider it. But in the vast majority of patients, a neck lift and a facelift scar are almost identical with the exception of a small extension under the temple. And I think the time of surgery takes about the same. I'm always loath to offer a neck lift in isolation because the worst thing you can do is tighten the neck and then have the jowls continue to hang over. Again, remember, I focus on jawline enhancement. So yes, you can, but I typically will discourage it in this practice.
All right. Can I have a facelift and an eyelid?
Blepharoplasty.
So
eyelid lift.
Can you do it at the same time?
Absolutely, and I would say in at least 50% of the facelifts I do, we do some degree of eyelid enhancement at the same time. Right. Uppers, lowers, both, brow lift. That is usually, I would say 50 to 60% of facelifts include at least upper blepharoplasty, which is an upper eyelid lift.
Okay. And how long does a facelift usually last?
It depends on patients. The younger you do it, I'm noticing that the longer it seems to last. The higher quality your tissue is. If it's a primary, meaning the first time facelift, it typically lasts longer. If it's a revision facelift and you're older and your skin quality is not as good and it's not optimized, it typically is shorter. Classically, we learned that a facelift is designed to set the clock back 10 to 15 years, but that clock keeps ticking. So at that point, you're going to eventually want a little tuck up or something else like that along the way, and that is a very, very individual answer.
Okay. Patients say, I have dark circles under my eyes. Will facelift help get rid of them?
Patients say, yes, I was with you. I heard that question last week. And the answer is it depends on why you have dark circles on your eyes. I happen to have dark circles under my eyes too. With a facelift, I typically do some degree of fat augmentation of the midface. And that includes the tear trough, that includes the lateral orbital rim. And if the deep dark circles that you have are because of basically bony insufficiency in that area, I can help that for sure. If you have dark circles because of big fat bags under your eyes, it may necessitate an adjunctive procedure like lower blepharoplasty at the same time.
All right. Where are the facelift scars actually?
I think we have a video on that too.
Okay.
Can we post that right here as well?
Yeah.
Okay, so click on this link if you want to watch that video. But essentially, just a quick Cliff Note answer. It's going to be underneath the temporal tuft or extending into the temple, along this part of your ear, behind the tragus, which is this little cartilage tab, along the front of your earlobe, behind your ear, across, over and down the hairline. Can we see yours?
Sure. Go ahead.
I don't know. People want to know if we can see faceless scars. You tell me.
Oh.
I don't know. You can answer this question better than any of us, Susan.
For me, I don't notice my scars anymore. So
I don't see any scars.
yeah, I wear a ponytail and...
But they're there, and you're going to see them for 3 months at least, and they're going to be red.
And they fade.
But they fade, and we place them very, very carefully to prevent visible scarring.
Yes.
Okay.
Okay, the next one is, how painful is it?
Wow, I think you can answer that question better than I can too. But I will tell you that my patients do not typically complain of pain.
Right.
Compared to tummy tuck, breast augmentation, and other procedures that have to do with like muscle tightening and tendon and bone, a facelift is soft tissue only, and that tends to be less uncomfortable than more invasive procedures.
Yeah.
So 2 out of 10. If a tummy tuck is 8 out of 10, C-section is 7 or 8 out of 10, maybe this will be a 2 or 3. And it's usually right here you feel a little bit of tightness.
Yep. Very good answer. Okay.
Is that accurate?
Is
that consistent with your experience?
I would say that's consistent. Okay. More annoying than anything, but
more annoying.
But worth it in the end. Okay. What will I experience right after surgery?
You're not going to remember much. I'm kind of sitting at your bedside, looking at you, shaking your toe, and you're groggy, and I say, hi, how are you doing? You look great, everything went well, and you're like, Then I'll call you that evening, and usually if you're at a nursing center, you don't pick up because the nurses are, have your phone aside and they're watching you. I'll be in touch with your nurse that night if you are at a nursing facility, or you or a loved one if you're at home, and ask you a few questions, make sure everything's going well, tell you everything went great. Probably gonna be a little bit groggy, maybe a little bit of a sore throat. Nuisance with the facelift compression. It's like an old-timey football helmet. No drains in most cases, but sometimes in males and other patients I will choose to place drains. And probably acceptable levels of pain.
All right. What do you have a specific age you think it's best to undergo for a facelift?
Again, I typically think that my favorite results, the fastest recovery, the most beautiful results tend to be in younger patients, and the trend is towards doing facelifts at a younger age to preserve beauty and optimize beauty while you have your glory years to enjoy it. I think everybody's a candidate. Classically, we wait until 60s, 70s to do facelifts, but by that point, the tissue quality is compromised with sun damage and other things, and so you don't get those long-lasting, durable results that you might get if you chose to do it younger. My average patient for a facelift is now, I think, 46 last time I checked.
Right.
So it's getting younger and younger, but I think that it also helps explain my results are the way they are.
I know, they're outstanding. Okay, how much does a facelift cost?
I'm not going to even go there.
Okay. Well,
If
that's
you're
what they
interested in
wanna
it, I know everybody wants to know, and I'm going to see a lot of comments below, I'm sure, how much does it
Yeah.
cost. Really, best thing you can do is make an appointment with me, depending on your your history, if you've had previous facelift, for example, or depending if you want to do eyelid surgery with us, brow lift, CO2 laser resurfacing, other things like that, chin implant. It's going to impact the cost. If you want to call our main number, 949-432-4730, during business hours, I'm sure the front staff can give you some direction, some ballpark estimates, but really an in-person examination and a detailed history is necessary to answer that question, which you are really good at answering.
Yes, those questions I can answer. The next one, are the results permanent? And we know the clock ticks on, so there you go.
The clock does tick on, but the results are permanent in the sense that surgery is forever. When you
Absolutely.
cut out skin and you tighten things,
It's always tighter.
It's always tighter. The tissue quality is always improved, and any sort of anatomic features that you didn't like that have been addressed are going to continue to be addressed.
Absolutely.
How time, gravity, and your tissue qualities respond to those
And take care of your
phenomena.
skin.
And take care of your skin. CO2 laser, sun exposure avoidance. There's a lot of things that you can do to protect your investment, and we will talk to you again on an individual basis about these questions.
All right.
That's it?
That's it.
That's all the questions?
Those are all my questions.
All right, so we went on a little bit longer than I was hoping for. But I hope if you guys are considering a facelift or a facelift with me, that one of your questions in here got answered. But if you have any additional questions, please don't hesitate to reach out. We are happy to see you in person. Call, schedule a virtual consultation, in-person consultation, or just subscribe and leave questions below, and I'll do my best to answer them. Thank you so much for your time.
Thank you.